Hello, and welcome to the AMA's Steps Forward podcast series. We'll hear from healthcare leaders nationwide about real-world solutions to the challenges that practices are confronting today. Solutions that help put the joy back into medicine. AMA's Steps Forward program is open access and free to all at stepsforward.org.
Hello, and welcome to this episode in the AMA Steps Forward podcast series. This is your host, Dr. Kevin Hopkins, a family medicine physician at Cleveland Clinic and physician director of health system engagement here at the AMA. How many days do you take off work in a year? I mean, really off, like totally disconnecting, not doing any work-related tasks, not reading emails, not thinking about how to solve a problem at the office, or reading about the symptoms of that one patient you just haven't been able to diagnose. About 5 years ago, our family was on a vacation at a large, very well-known theme park resort in Florida. During one of the mornings, my phone rang, and I answered it, not at all expecting who was on the other end. It was a patient of mine who had called my office and had somehow been cold transferred directly to my mobile phone. Imagine my surprise, and his. I explained the situation to him, and he apologized for the strange circumstances through which we had been connected, and then he proceeded to let me know about the problems he was having. I, of course, listened and gave advice on how best to treat his symptoms, taking a significant break from my family time, including a couple additional phone calls to my office, and then being frustrated about it for the next few hours. According to survey data, physicians typically have 25 to 35 days of paid time off, or PTO, each year, and yet a 2023 study of over 3,000 U.S. physicians across multiple organizations and specialties revealed that approximately 60% of U.S. physicians reported taking 15 or fewer days of vacation per year, and 20% reported taking 5 or fewer days per year, less than a week. The same study showed that spending more than 30 minutes a day on patient-related work during vacation was associated with higher odds of burnout. On the flip side, taking more than 3 weeks of vacation per year, or 15 weekdays, and having full electronic health record inbox coverage while you're away was associated with lower odds of burnout. Imagine that. Time away from work responsibilities to rest and recover from work-related physical, mental, cognitive, and emotional demands is crucial. To discuss the importance of disconnection, I'm joined by our guest, my good friend and colleague, Dr. Rob Saper. Rob's chair of the Department of Wellness and Preventive Medicine at Cleveland Clinic. Thank you, Rob, for being on the podcast.
Thank you, Kevin. It's a pleasure.
Well, before we get started into our topic for the day, would you mind, Rob, telling our listeners just a little bit more about yourself and background than what I was able to share?
It'd be my pleasure. I was a medical student at Harvard Medical School in the 1980s. And after medical school, I went to UC San Francisco for my family medicine residency and was in private practice in the Bay Area for about 8 years. Then I moved back to the East Coast, and I'd always had an interest in alternative or complementary therapies. And I did a research fellowship back at Harvard for 3 years to really learn how to study in a rigorous way alternative medicine practices, meditation, yoga, acupuncture, etc. And that really got me into academics and research. And then I went on to Boston University, where I developed a program with colleagues called Integrative Medicine and Health Disparities, where we really learned how to try to deliver these kind of holistic approaches to a very diverse group of patients. I was fortunate to come to Cleveland Clinic 4 years ago now and have this role. I'll share just one little story to give you a hint at my interest in this area. I was at Harvard doing my third year of rotations, and we all know how hard those are, going from one field to another field to another field with a new knowledge base, new people. And as a medical student, you're lowest on the pecking order. And by the end of that year, I was really burned out and down and really questioning whether I was in the right place doing the right thing. And so I decided to take a year off, and I ended up spending 8 months at a meditation and yoga center in Western Massachusetts called the Kripalu Center for Yoga and Health. And during that time, I woke up at 4:30, did 45 minutes of yoga, then 45 minutes of meditation, ate a yummy vegetarian, healthy diet, and went on my way in the beautiful Western Massachusetts Berkshires. And honestly, as I look back in my life, I felt so healthy then. I don't know if I felt healthy or as healthy since then. But I share that story because it was such a contrast between how down and depleted I was in medical school and how lifted and vibrant I felt there. And that's really when I developed my own personal mission, which is to try to change healthcare and the life of healthcare providers in a way that is more human centered, more respectful of our own needs, realizing that if we are not well, then we can't make others well.
Rob, I may have had a glitch on my headphone. I thought you said 8 months. Did you say 8 months?
It was 8 months. And I'll even share another bit of a detail is that it was a ashram with a guru. And that was something that my mother was absolutely not happy about. May she rest in peace as a fine young Jewish, medical student. But I did take a lot from that experience and have tried to incorporate the positives as I've gone forward.
So I know we'll get into this topic, but right up front, I'd love to ask you, how did you find the ability to really disconnect and take that amount of time away?
Honestly, I felt like I had to, right? When we get so low, and perhaps many of your listeners have experienced this, when we reach a nadir, we feel like we have to do something. There's an existential feeling of like, if I don't do something now, I'm going to explode or I'm going to die or I'm going to not continue on with school. And then, of course, what I did is I framed it as a research project, of course. to get the okay from my medical school administration. So I took a year off to study alternative medicine in the context of intentional communities. That was my research topic, and I can talk about that too another time.
Fantastic. So you were already thinking about it as a critical researcher and how important this would be to your overall well-being for the long term. That's great. In your professional opinion, what does it mean to really disconnect as a physician in today's world? Because we're so connected, right? And so what does that look like today to really disconnect as a physician?
Well, first of all, I want to say it's really hard. I don't want any listener here to think, Saper or Hopkins, they have it all figured out. It really is hard and it takes work, paradoxically. So I think of it at two levels. There's the disconnect when we're outside of the workplace, and then there is almost micro practices or micro disconnect when we're actually in the workplace. So I'll talk about being outside the workplace.
So kind of the day to day, and then bigger, longer disconnections, and so how to do it throughout the day, how to do it at the end of the day, evenings, weekends, things like that, and then also time off. Is that what you're saying? We need to think about it in terms of those buckets?
Yeah, absolutely. Because certainly vacations and weekends are precious, and we can talk about how to make those special and rejuvenative. But if we're going through our entire week and every day just waiting until the next vacation or waiting until the weekend, that would be another example of something we do as doctors quite well, which is delayed gratification, which isn't necessarily always the most adaptive strategy.
Well, I would guess that's the short term, smaller breaks and disconnection, for instance, during a workday is something that maybe a lot of us haven't thought as much about, except for maybe, I hardly ever take a full lunch break to do something and disconnect from work. And typically, if I eat lunch, eating at my desk, looking at a computer screen, that kind of thing. So that may be an area to disconnect that maybe most people haven't thought much about.
Yeah, let's talk about that first. We, as you know, at Cleveland Clinic developed something called the Wellness Minute. And what that is during a large meeting, we take literally 60 seconds to do a simple wellness practice. It could be 5 deep breaths. It could be a simple stretching exercise. It may be a reading, maybe a short poem, and then to reflect to. And what's remarkable in those situations is we can actually reach a moment of calm in that period of time. We're not used to doing it. It takes intentionality, but it's absolutely possible. It's very similar to what I do with my patients who have anxiety or panic attacks. Just by introducing to them a simple relaxation technique such as deep breathing, they can experience relaxation in that context. And so that both gives people tools, but also sends a message that our well-being and our wellness is important in healthcare.
Yeah, there are things that you can do right in the middle of a busy day. I mean, I used to think, gosh, the only time I'm alone during the day is if I go to the bathroom. And sometimes I would go to the bathroom, not because I had to go, just because I needed to be away from other people for a little while with sharing offices or not having an office or, things like that. You just can't get away. And there's always some background cognitive load. But I enjoy when you do those wellness minutes. And that's when I first tried boxed breathing, and I use that now probably daily, just as a little bit of a break, and I always feel better afterwards.
Yeah. So when I speak about wellness, we're never going to reach a state when they're well. We reach a state when all our charts are closed. We reach a state when we've gone through our inbox and answered all the messages for the day, if we're fortunate and efficient. And so those are, attainable ends. But wellness is really an active pursuit. And we're all different. Some of us, what is optimal wellness for them will be different than the next person, and that's perfectly fine.
So, is there one type of disconnection that might be more important, more restorative than the others? And how do we figure out how much of each type we need?
Think about wellness as energy. We have physical energy, mental or cognitive energy, and emotional energy. And when we go to work, depending upon our unique jobs, whether we're in the OR or sitting face to face with patients in the outpatient, or maybe in psychology, counseling patients with difficult emotional or trauma histories, it draws upon these different energies or domains, physical, emotional, mental, and so forth, and can drain us. And we have to refill those. We don't have infinite wells of that energy and that resilience. So when it comes, for example, to the doc who is walking on their feet all the time in the OR, doing a lot of physical, strenuous energy, then maybe at home doing a 5-minute relaxation technique, really lying down and doing what we call the Shavasana pose. For someone who is really hearing a lot of emotional pain and trauma and giving a lot of compassion out all day long, sometimes you have to sort of get the negative challenges and traumas that you've heard all day, sort of get it out of your system and going for a run or going for a bike ride or doing something physical, walking your dog, or maybe even a run with your dog to sort of shake that off can be very restorative. So there's not one way that's the right way for everyone. However, everyone does need to do it in some way. Otherwise, the consequences can be significant.
So that's really interesting because I guess I never thought about that. If you work at, say, in a specialty that is more physical, like you said, I mean, maybe orthopedic surgery or some other type of surgery where you're doing a lot of physical stuff, it might be more physically taxing than what I do day to day, which is sit on a rolly stool in an exam room talking to patients. But I'm no less exhausted at the end of the day. It's maybe just more emotional. I feel emptied out and just worn out and exhausted. Is that why I feel that at the end of the day? Just because of the energy expended, even if it's not physical, but emotional, and I feel like I got to do something to rejuvenate.
Absolutely. We went into medicine to serve others, and all of us going into medicine have deep wells of compassion and empathy. And this is the beautiful thing about medicine. It's a calling. We're able to serve others. However, think about it. It's a one-way piece. We're giving and giving and giving of ourselves, whether it's thinking through a complex medical decision about how to balance fluid status, electrolytes, and their CHF symptoms without harming their kidneys, or it's the emotional toil of hearing so many difficult stories of sadness. It drains us. And that emotional and mental drain feels like exhaustion, and it is exhaustion. There was a psychologist in the late 90s called Meisman, and he talked about this effort recovery model that we are constantly giving out energy in those different domains, and so we have to somehow recover and refill that in ways at work and outside of work for us to be able to go back the next day to feel ready to do it again.
So because as physicians, like you said, we're helpers. We want to help people. We want to serve people. It's a calling. Is that part of why we're so bad at disconnecting? Like what do you think are the major barriers that most negatively impact our ability as physicians to really disconnect from our work?
I think that is one really important piece, that we care deeply about our patients. We care deeply about doing the best possible job for them. And there's a lot of T's to cross and a lot of I's to dot when we do that. And there's nothing inherently wrong about that. In fact, the opposite. We have to strive that way. However, we're not trained or taught skills on how to stop and pause and rejuvenate. Moreover, during pre-medical training, medical school residency, there is such a tall bar set for us to truly be perfect, to get the perfect score on the organic chemistry test, to get the high score on the MCAT, to get into the best medical school. And it just goes on and on. And so to strive for perfection, to want to be there for our patients all the time, it is truly the caregiver's dilemma. Because to provide the best care and the best possible care to our patients, we have to be full of energy. We have to be completely present. We have to be in the moment. But to be able to do that, we have to restore ourselves and therefore take a pause.
Whenever I fly, and they give the safety demonstration, I'm always reminded of this when they talk about putting your own oxygen mask on before helping others. And I know that I've said probably that exact phrase to patients who are caregivers and who are exhausted about taking care of others. And yet I don't always heed my own advice. We talk often, Rob, about how system changes tend to be more impactful around improving physician well-being and wellness and reducing exhaustion and burnout. And we'll get to that. I want to ask you some questions about that specifically. And yet, a lot of us work in systems that aren't structured very well to support our own well-being. And so I want to ask you, what are some personal strategies, real concrete examples that we could use individually for disconnection?
At Cleveland Clinic, as you know, Kevin, most of us have two cell phones. One cell phone is our work phone, and on that work phone are the various apps, but it's also our email and electronic medical record and so forth. And then most of us have our personal phone that we had from before we came to Cleveland Clinic. So assuming that I'm not on call, or there's no crisis, emergency, COVID pandemic, so forth and so on, from Friday evening when I stop working to usually Sunday morning or Saturday evening, I will turn off my Cleveland Clinic phone. And on my personal cell phone, I've wired it in such a way that I can't access my Cleveland Clinic email. I have like my Gmail. And so I cannot check email. Now, that, of course, doesn't prevent me from thinking about work or obsessing about the patient or what am I going to do. But it's a major yet simple structural piece to stop looking at email and the record. And it has to start there. Once you start there, then I immerse myself into activities that bring me joy. So being with my adult children, cycling, doing yoga, taking a hike with my wife, journaling, honestly, napping, because, we really should touch upon sleep. And I try my best during the week, but I'm sure I cut corners. And so I catch up on the weekend. And all those things really help restore that energy of mine.
So, yeah, I love a good nap, especially on a Sunday afternoon. But, as you were talking there, so for probably 6 years, I've only had one cell phone. I got rid of my personal cell phone and I just used my work phone. But you're right. I look at it for a personal thing and then I get sucked into some work related message. And maybe it's better for me to have a distinction between work and personal, even down to my electronic devices. I just did it for ease, a practical matter, carrying one phone rather than two. But maybe that's actually contributing to my own fatigue, exhaustion, and burnout potential.
You used a critical word, which is distinction. How do we create distinctions between our work life or boundaries between our work life and home life? Very difficult in the setting of 24/7 communication. But another example is when I'm, done for the day, done with clinic, whatever it is, could be 5:30, could be 6:30, could even be 7 p.m. And I shut the computer. I've chosen I'm not going to work at nighttime. Now, mind you, I have a long history of doing late night working, but I've decided here not to do that. But I have decided to wake up really early in the morning, like back in my ashram days, and start my day. And I do some nice quiet work early in the morning. But you see, it's really that distinction. where I'm not going to work at night. Obviously, there are exceptions if I have a big presentation the next morning or something, but on the whole, that's something that I can count on, and it's reassuring. It's not a lot of time, but it's a few hours that is mine.
Well, and we can probably all think of people that do both, that work late at night and get up early in the morning and are working over the weekends and all of those things. And so if you feel like you've got to work outside of normal work hours, pick one, but don't do it all the time, I guess, huh?
Yeah, and look, we're doing really important work, and people's lives depend upon it, livelihoods, and so forth. But is it possible that sometimes we take ourselves a little too seriously? And do we have to do all that work? Or moreover, are there some things that we cannot do? It's just a question. There are people in our profession who have huge responsibilities, which are so important. But I do think there's an element inside of us where we have to make some choices. And, work can be an addiction as well. There's a great dopamine lift, right? We get when we're responding and we're getting the emails and we're checking off boxes and so forth. And I do it, we do it, and so forth. But fortunately, it's an adaptive addiction or habit, and it's better that than maladaptive things like overuse of alcohol or drugs or so forth. But I think it's worth looking at.
I'm a big to-do list maker, and I have 3 to-do lists. Sometimes after I've already done something, Rob, I'll put it on the list just so I can have the pleasure of crossing it off. But I try to break it into 3 different groups: things I must do, things I should do, and things I could do. And oftentimes the things I could do don't get done because they're just a lower priority. But I focus on the things that I must do as a way to be productive. But that's how I try to prioritize even my to-do list. And it's tough to let things go, right? Because a lot of us are perfectionists and we want to get it all done. I heard you mention a personal well, and I've heard people talk about that, a well of resilience, or I've heard people talk about filling up their bucket, or if you've got a hole in your bucket that you can never keep it full. And we use the words distinction and boundaries. How does establishing and maintaining some healthy boundaries contribute to somebody's well of resilience and overall well-being?
It is okay for us as physicians, and for that matter, as husbands, wives, adult children, so forth and so on, to sometimes say no. It's important that we say no thoughtfully, with kindness. It's important, particularly if the no is going to be, very disappointing to the other person, to provide a rationale, perhaps, why we're saying no and hoping for the other person's understanding. We all do this in clinic. We've spent a good amount of time with the patient. We've made some good progress in the various issues, and they want to continue more, and we simply can't because we're already 2 patients behind. And so we apologize and say, I'm really sorry, but we have to stop. And I think we need to practice that. And I loved what you said about prioritization. I also like to use the word discernment. Like, how do we discern between must do, should do, have to do, and could do, and that takes time and reflection, really, to assemble those priorities.
What role does the health system play in supporting individuals' ability to disconnect? You and I have both have experience being health system leaders, and I mentioned that oftentimes system changes can do more to help physicians maintain their level of well-being. But what do you see as the role of the health system in supporting individuals' physicians' ability to disconnect, and how can we, as organizations and health system leaders, foster a team culture that really prioritizes it?
Health systems play a huge role in this. And some of the things that systems can do are actually relatively simple and low cost. Healthcare system leaders, from CEO to institute chief to directors and chairs, we can message to our team that our well-being as caregivers is central to the success of our organization. And it's true, and data supports it. If we're burnt out, healthcare outcomes are going to be worse, productivity is going to go down, attrition is going to go up. So it's real. And to simply make that message, then that communicates and helps generate a culture where well-being is kept as important. That's one. The second is to create structures where physicians can have some degree of reasonable autonomy and flexibility in their work schedule. Now, we know when we're running a large healthcare system, we can't just say, okay, start whenever you want to start. You'll start at 7 and you at 9 and so forth and so on. However, we can create choices because we need to be open from early on in the day to the evening. We can give people choices. Some people may want to work every evening in the clinic, and that works for their families in a better way. So,
yeah, I've been looking for that person for years to recruit. If any of you are out there, please contact us. Sorry to interrupt you. Go ahead.
So some flexibility and autonomy, I think, for the docs and in some simple, basic things. Maybe you need to take 2 hours off and not a whole day off to be able to go see your child in their, preschool play. What a beautiful, joyous thing that is to be able to go to that play and create a PTO system where you can have a 2-hour PTO and have that count so that you can do that and take care of your family responsibilities as well. Technology. We're about to have an artificial intelligence scribe launched at Cleveland Clinic. That's a big investment of money and technology, and I think that's going to help us. But at the end of the day, we need to think about workload. At the end of the day, the number of patients we see is directly proportional to that energy that we have to put out and the number of messages we see. And so we need to have a high productivity so that we keep our organization successful and keep the lights on and have everyone get paid and so forth. But can we find that sweet spot where we're highly productive, yet give providers a little bit of breathing room? And I think we're working on that well here at Cleveland Clinic and really moving towards accomplishing that.
In our AMA organizational biopsy that helps health systems and practices assess the well-being of their organization and of the physicians and other healthcare professionals in it, one of the things we ask is, what are the barriers to taking time off, like real time off? And we have a steps forward toolkit called real PTO rather than fake PTO. And one of the things we hear over and over from frontline physicians and others is that, gosh, when I come back from being away, even if it's for a day, my electronic inbox, especially in the EHR, the electronic health record, is just overwhelming. And so I don't take time off for that reason, or I have to find somebody to cover my inbox for me or my patients for me. How can health systems support individual physicians in logistical issues like that from a well-being perspective?
Requiring each practice to have a very explicit coverage or on-call schedule, or creating dyads or triads so that we know that when we take PTO, our patients will be covered, at least hopefully a majority, at least the critical inbox subfolders will be managed, and that we don't have to bring our laptop with us, and we can truly be out of office. So this way, by a system being created, we don't feel like we have to go to the other person and say, hey, Kevin, I know you're really busy. Would you mind, pretty please, covering my inbox for me when I'm out? And then you feel guilty and, we're friends and you say, okay, Rob. But the reality is you're already covering 2 other people's spots. So we have to do that. And to do that, we have to be a team. And with the pandemic, my concern is as we've gone more virtual and so forth, we've come together less as a unit, as a team, and talk through things. Hey, let's create an on-call schedule. Who's going to take this first week? Who's going to take that second week? I'm happy to. That sort of thing. The second piece is put an out-of-office message on your email and on your inbox saying that you're out. And I'm seeing a very interesting trend recently. People are saying not only I'm out of office and I'll be returning, February 25th, but they're saying I'm out of office. I'm spending time with my, adult children on the West Coast. I have a new grandchild and really appreciate everyone who's caring for my, patients. And I'll see you back on, February 25th. So to bring a little humanity into the out of office message, I think is powerful. And then we have to encourage people to use their PTO. We have to actually almost maybe even incentivize it or encourage it, in my opinion. Because as you've taught me, folks who take more than 3 weeks of PTO, they have less burnout and they're more apt to stay with the organization. And we have to look at caregiver well-being in terms of if folks get really burned out, they're going to cut back on their FTE or they're going to leave. And that's going to be a loss to the bottom line. So I think from both a humanitarian point of view and a financial point of view, it makes a lot of sense.
Yeah, it does. There's certainly a business case for investing in physician well-being. You mentioned some of the things that were incited or accelerated by the pandemic, and it just made me think. I wanted to ask you specifically about remote work from home. I'm actually sitting in my home office right now. I'm working from home. I work from home a couple of days a week. How do you think remote work or work from home has impacted our ability to disconnect from work?
I think it's incredibly impactful because when we're working from home, there is no distinction. There is no boundary between your office and your home life, right? And of course, there are really a lot of positives about that, and we've all seen that, and there's nothing wrong with that. However, in healthcare, many aspects give us joy, but at the end of the day, not only is it the connection with your patients, but it's the connection with the colleagues and laughing about something funny, commiserating about something very hard, getting support from each other. We have to come together as physicians and caregivers as a community. And so, as leaders, we have to really keep that foremost. So, we're thinking about productivity and RVUs and slot utilization. To make that all work, equally, we have to think about how can we bring these folks who are at home, remote, or way off in the clinic in Olmsted, and they're off in this clinic on the east side. How can we physically bring them together? And then, even if we can't physically, psychologically make people feel that they're part of a team. Because joy, laughter, connection, we need other people to do that. We can't do that alone.
Do you think, Rob, have patient expectations changed as a result of direct access to their physicians, technology, all those things? Do you think that patient expectations of us affect our ability to disconnect at all?
Maybe, but that's a problem that we've created.
Yeah,
It's not the patient's fault.
right.
Our patients are they're seeking connection, they're seeking advice, they're seeking someone they trust, and they're having trouble accessing us. And so we have to think of creative ways that we can be there for our patients, but have it fit, you know? I'll never forget, I was a medical student doing my family medicine rotation in Cambridge, Mass, in a private practice. And from 12 to 12:30, after the morning patients, my mentor, the doctor, took these quick phone calls, like 2 minutes, 3 minutes, and they were all lined up. Remember the old telephone with all the little red buttons and they light up? So he would just go from 1 to 2, and the assistants had lined them all up. And so he's just responding to these people in this human way of what their questions are and concerns are. That worked.
Yeah, right. The more our technology is advanced, sometimes it's actually prohibited our ability to be as efficient as maybe we once were in a different day and age, right?
Perhaps.
Probably my last question for you. You're a department chair at a large multi-specialty organization. We have an enormous amount of employees, caregivers, we refer to everyone as here. How does a department chair or other health system or practice leader best model these behaviors by example? There's so much good research that shows that the person most likely to impact a physician or other healthcare workers' well-being as it relates to work is their first line leader, or the person to whom they directly report, and what that relationship's like and the culture that person enables. How do you do that? How do you best model these behaviors by example as a leader?
3 ways. One is gratitude. Someone steps up and goes the extra mile, express gratitude. If someone speaks up and shares a complaint or negative feedback, share gratitude. That is one. Two is kindness. Understanding that, for example, anyone should be able to ask for anything. It doesn't mean that I can necessarily grant it, but good for them for asking, and either I can come through with it or kindly say no. And then the third piece is maintaining equanimity, and that comes from going a little bit slower. So in healthcare, things are going fast, right? Whether it's in the ER or in surgery or just in a day of primary care. However, not every decision has to be made immediately, right when you get an email or request. We can pause and consider it. When we're in conversation and someone is saying something that's challenging, we can pause and take a deep breath, collect our thoughts before we respond. I think these so-called soft skills, they used to call them, I think these are actually the necessary skills for the leader to model an approach of being in a busy healthcare system that is sustainable.
Great. Thank you. Great thoughts. I've I also know you've done this as a leader and modeled this, even just something as simple as putting in your email signature line, hey, you're not expected to reply to this email evening hours, weekends, when you're off work. And it's something that we can do one time and not have to think about it again. But if we follow that example, I've heard you talk about scheduling a time to send emails rather than doing it over the weekend when I might be doing it because it's a good time for me, but it might not be a good time to receive it. And yet somebody who works for me as my direct report, if they see an email from me on a weekend, how likely are they to wait and look at it on Monday? They're much more likely to open it now and to think about it. And now I've disrupted their weekend unintentionally. So those are some small but tangible things that we can do that may have an impact.
So true. So true. Using technology to your advantage, we have the Outlook 365. It allows you to delay sending a message until Monday morning at 8. You can create a signature, as you said, and put a message there. And this helps create a culture of respecting boundaries and of well-being.
Are there any keys that we've missed, Rob? Any pearls that you'd like to share with our listeners that maybe I haven't asked you about or we just haven't got to in our discussion yet before we wrap up?
If we can create opportunities during the day for well-being, encouraging people to take their lunch, take 3 or 1 deep breath before going in to see that next patient to make that transition, to have a team meeting or team huddle, and as part of the agenda is celebration. Who can we celebrate today? Who can we appreciate today? Because everyone has to feel appreciated. And we as leaders can help that celebration because a lot of folks are a little shy about speaking up, and I get that. But every day, our medical assistants, our environmental services staff are doing extraordinary things. Modeling and celebrating them and appreciating them makes us feel closer to the work, closer to the purpose of the work, and less cynical and more engaged.
Some great advice and wisdom from an experienced leader and an expert in well-being and wellness. Thank you so much, Rob. It's a good reminder for us to approach every person and every situation with, as you said, gratitude, kindness, and being willing to slow down and go a little slower. So thank you for those things. Dr. Rob Saper has been our guest today, Chair of the Department of Wellness and Preventive Medicine at Cleveland Clinic. Check out the episode description to explore resources mentioned in today's episode and related to this topic, including the Value of Feeling Valued Steps Forward Playbook, Real PTO for Physicians, and the Wellness-Centered Leadership Playbook, and others from AMA Steps Forward. Until next time, stay well.
Thank you for listening to this episode from the AMA's Steps Forward podcast series. AMA's Steps Forward program is open access and free to all at stepsforward.org. Steps Forward can help put the joy back into medicine by offering real-world solutions to the challenges that your practice is confronting today. We look forward to you joining us next time on the AMA's Steps Forward podcast series. stepsforward.org.